Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can be profitable and successful for years to come. This week on the Edge Podcast, I'd like to welcome my good friend, healthcare consultant and compliance professional, Stephanie Allard of Stephanie Allard Consulting, LLC, back to the program. Stephanie is a certified compliance consultant in the revenue cycle management side of healthcare and a subject matter expert in more than 40 specialties and subspecialties in the healthcare field. She also performs forensic audits in the healthcare space that includes focus reviews used in court cases and payer investigations. Stephanie and I have worked on many auditing and educational projects together, and we continue to collaborate in the industry on a daily basis, actually. So, Stephanie, welcome back to the program.
Yes, thanks for having me.
So, Stephanie and I thought we'd start off, the new year in January, challenges for business healthcare consultants and how to manage them. So, consultants, and let me just define that, consultants often face hurdles. So we have to coordinate efforts across now geographically dispersed teams, especially with virtual workflows, managing data that we're dealing with, especially if we have an ongoing client, and maintaining really good seamless communication within the organization and outside the organization. So we have a lot of challenges when it comes to being a consultant. And Stephanie and I are here to have a chat about that and, just see how we can maybe help some of our fellow consultants out there manage that. So here we go with kind of that topic and what we're dealing with on that space. So first, Stephanie was here. We were chatting way back, I think, in 2025, March or April, about how to hire a consultant. And so just to revisit that a little bit, first of all, if you're hiring a consultant and you are confident that they are qualified and that's who you want and you're trusting, you need to listen to them. And I think we find a lot of times where we give advice or we make recommendations or suggestions or give findings even, and the pushback is crazy. I know we've dealt with it just this week in 2026.
Yeah, it's always surprising to me when someone hires you to come in, especially with something like the audits. We're there for, hopefully prevention and making sure that our client is going to have, their best foot forward in the event of an external review. And then they get mad because there's adverse findings in the audit, or they'll say, well, the last company didn't have that, or things like that. And it's definitely a big issue where, we're not just there to check a box. If we were there just to check a box and move on, then you could just hire anybody, really. You could find someone who would say what you want to hear, and you could bring anybody in to do a review and sign off on it. But it's very important to make sure that consultants you are looking for have hands-on experience in what it is you're dealing with, and that they have your best interest in the forefront of the work that they're doing.
It's true, because it reminds me, and I know this is probably an elementary way to say it, and it's funny I use that word based on what I'm going to say, but back in the day when I was, this is a long time back in the day, I'm going to age myself now, we used to have something called MGM, Mentally Gifted Minors, and when I was in second grade, I was enrolled in the program. And it was kind of interesting. We basically were tested. We were asked to help tutor some of the kids that had issues. I was in it through fifth grade. And then I noticed when my daughter, who's now 30, when she was that age, they were asking if I wanted her in GATE, which was a similar program in elementary school, but it looked like it was just more homework. But then I found out, and this is where my analogy lies, I found out that it wasn't just the school testing or noticing that you've got a child who maybe has some, specialized skills. There were parents that were mad that their kids weren't asked to be in GATE or qualified for it. So they'd go outside the school and hire somebody to say that they were qualified, and you'd see these kids struggle. So the reason I mention that is because, like you said, you can find anybody out there who's willing to take your money to be a consultant and say, oh, yeah, you're doing things right. But then who's actually there to support you when you find out that actually that's not correct? And I think one of the things, Stephanie and I were actually involved in a meeting today, right before we were recording our episode, where it was clear that the client was like, yeah, we were really disappointed at the audit. But then after our hour discussion in the post audit meeting, they were pretty happy people. They were fixable things. There were more workflow issues than really errors that we found. And just talking through things and getting our advice and expertise and our cited resources and references and published guidance and all that, so that they could put into practice how to fix, some of the issues that we found from a compliance or coding or whatever perspective your industry is for the listeners. I think it's important that you really remind your clients that we're here to help you. We're not here to be negative. We're not here to, shut you down. We're here to help. We want you to be successful, because the more successful you are, the more successful we are. And Stephanie, I don't know about you, but 65 to 70% of my business is repeat business.
Hmm. Yeah. Well, and I'm just coming out of my first year in business, but it's really been a great year, and I have a lot of repeat projects. I have, clients that I've done work with from an education standpoint, and now, they're hit with this issue with the payer. They really need help. We've got that trusted relationship. So yes, I'm very happy with the direction that I've been going in. And it shows when people care about what they do. As far as us as consultants, that's something where if we didn't have that empathy in us and we didn't care in that particular way, I don't know that we could do as good of a job as we do.
Yeah, and I think the one other thing too is, as far as, the challenges that we deal with, is that and I'm speaking to, the masses here that are thinking of hiring a consultant, or they have a consultant and maybe they're the administrator or the office manager or someone that's trying to get through this information that's been given by their consultant to their providers, and their providers are pushing back. There really needs to be a meeting of everyone together. When you start having meetings where, okay, I'll meet with the consultant and I'll let the doctor know what you said, something is lost in translation. It gets very muddled. One of the things that happens is there's a good analogy, and I don't know if everyone's going to like this, but I just read it and I actually didn't realize it. But you know that our Secretary of War, which we used to have a Department of Defense, now we have Department of War. It used to be called that back in the day. That's what it was called in the 1800s. And then I guess, late 1800s, early 1900s, they thought that was too mean. So they basically wanted to soften it and called it the Department of Defense. And, we're back to the Department of War, because we're saying, don't mess with us and in this country. And the reason I bring that up is that sometimes I feel that there's such a disconnect with being direct versus serving up softballs sometimes when you're working with providers and saying, well, what you really should do is this, instead of saying, look, you can't bill that way, or you can't submit, claims that way, or you can't run your practice that way, or you're going to get in trouble. So there has to be a fine line between working with your consultant on all levels, meaning that you don't just take the information if you are an administrative level and then try to softball it to your providers. They need to be involved in the process if they're the ones making the decision. Have you run into that, Stephanie?
Yeah, I have. And, one other thing that reminds me of as well is that when organizations take that approach where they don't have the consultant working directly with the physicians and the other practitioners, it also can hinder the process, because those people have probably already been saying what we're going to go in there and say. So it's
Yeah.
one of those things where, yeah, sometimes we do have new findings, but if we're working with an organization that has a full coding team, a compliance team, an audit team, a lot of times we're coming in, we're reassuring them that they're on the right path, and then we have to come in and hopefully start those changes that have needed to occur for quite some time at that point.
Right. And, we work with a lot of different organizations. I know that I mentioned one that we were having a conversation with today, and it was nice because they had the revenue cycle management people there, they had the compliance people there, they had the VP of ambulatory care there, they had, the departmental heads there. We didn't have physicians today, but it was nice to know that everyone was appreciative of the information and saying, okay, yeah, all of our departments need to work together so that we can make sure that these workflows work for everyone, and then we're all bringing it to the physicians, not just the department heads from an administrative standpoint. But then we also have other clients that we work with on a regular basis that we love them, but we get a lot of, well, we found this doctor was non-compliant. And then we get them saying, well, with that doctor, we kind of let them slide on that. I'm like, what are you talking about?
Yeah,
I
that's
mean,
very frustrating.
I know. I'm just like, why are you letting that doctor slide when you've got, 150 physicians and nobody else gets to slide? And why are we here? Why are we doing that?
Hmm. Yeah.
Yeah, it's
Yeah, they
crazy.
don't they don't always like when that is pointed out.
Well, even I think you and I had, well, kind of share a client. I know you work with me with this client where the doctor was undercoding because they were getting out their information quicker, didn't want to document everything that was needed for the higher code. And we were finding the loss of revenue was astounding. I mean, and it was crazy. And we had to pick through the fraud, waste, and abuse federal guidelines to say, look, you can't do this. If you don't code what you actually did, it's a problem. But I don't think, and I think this is the big thing, Stephanie. I know we're kind of focusing on revenue cycle management, and there's other aspects of healthcare business administration. But if you, let's just say, if you submit something that is low level, and the patient ends up, but it was audited at moderate or high, and the patient ends up needing high level care, it's not going to make sense to the payer. It's going to roll
Mhm.
downhill. They're going to say, well, wait a minute, you build a low level, evaluation and management service. Why are we now seeing a high level surgery being, pre-authorized request?
Well, and I think that people don't realize that that risk can still exist there, even if they're undercutting themselves. That could look like an issue. I'm not going to say our keywords for problems that we deal with in
Right.
compliance, but it could look like one of those hairy situations there, just because they're doing it out of convenience. Or the thing that surprised me the most was that that particular physician was in some kind of leadership position.
Yeah.
It's like, hello, how
I
does
know.
that work?
Really? Okay. And it's funny you say that because I do find when I'm doing an audit or I'm evaluating a practice and I find the outlier, they're usually like, oh, that's our compliance officer. I'm like, you're kidding me. So I'm just like, okay, that's interesting. So, that, I mean, that's like putting the person in charge of fire control who was the arsonist. I mean, you have to be careful with, giving allowances to your providers or your clients when your job as a consultant is to make them better. And I think sometimes too, our headaches stem from not defining the work relationship. So
Mhm.
once you contract with your client, once you are in the job to assist this company, explain the specific, expectations and outcomes, and define that working relationship between yourself, the consultant, and the healthcare provider. Expect, talk to them about meetings and what you expect as far as outcomes and you know what the deliverables, if you will. And otherwise, it's really going to be all for naught, or there's going to be some frustration on both sides. And the pushback sometimes that we get, we just shake our head and go, really? And most of it's positive. I mean, I've been in the industry now 40 years and been a consultant for, gosh, I'm going to age myself, 33 years. And so, and I know, Stephanie, you worked for a very large corporation, and I still considered you a consultant for 20 years. But I know you've been independent now for a little over a year. And I'm sure you've met those challenges too, but then you've realized, hey, I'm independent. I'm telling you like it is. You don't have to worry about, the trying to not make waves within the company.
Well, and I think some of that also just comes with the years and with experience as well. Because, for example, I had a situation this last year where a CEO had not been involved in a project pretty much the whole time that this team was developed for and this project was going on for. And then he steps in and completely wants to, I'll just say, shut me up, honestly. He was being very direct. He had a lot on his plate. He had a lot of frustrations he was dealing with, but he was not recognizing anything that was going on. It's like when you say, read the room.
Yeah.
And a lot of people, that's one thing that is nice about being a consultant. You're external. You're not sitting there worrying about, oh, this is my direct report boss or things like that. Sometimes consultants worry in that way, but I'm beyond that. I'm not there to kiss people's feet. We're there to make sure things are compliant. And I know my name's going on it, and I have a standard for myself, and I'm not deviating from my standards to pacify somebody else.
Well,
And we were leading
yeah.
into that territory. And I'll tell you, I'm going to say I was uncomfortable, but not meaning that I wasn't able to handle the situation. I was uncomfortable in the way that I had gone to someone else and said, look at this is important. This is how I was treated in a meeting full of other people, which is not acceptable for me or anyone else. Nobody should be treated that way. And then, I had to have that conversation that if they moved forward with what the CEO was stating and completely ignoring my compliance, not even suggestions, but guidance, then we were going to have to part ways. There's no way I could move forward from that. And Terry, I don't know that everybody would be able to do that.
Yeah, I don't, it's hard because I think a lot of consultants, and I've seen them say it to me, that, because I've turned down a couple of, in my, over 30 years at this, I've turned down a couple of jobs, I should say, or a couple of projects and just said, no, that doesn't fit with, in line with, my standard of what I do if you want me to do that. And they're just like, you're kidding. And I said, no, I'm not kidding. And then we get the providers that say, okay, you know what, that I don't want to pay that, so I'm going to negotiate, I'll pay this. And it's like 50% of what you're saying. I'm just like, you you don't understand. This is our business. We get to define that. And then we mutually decide if we're going to enter into an engagement contract. And I find that some consultants tend to take every single project, every single job, when sometimes you have to look and see, is it really worth the headache? Is it really worth, knowing that you're going to have a lot of pushback? And that initial meeting is really huge, whether it be through email, through, a Zoom call, whatever. But you can usually fill out the client pretty quickly to say, is this going to go right or wrong? But I also wanted to mention that recently I had someone say, and I was telling you about it, where they're like, well, can you go ahead and audit, 10 to 15 records for us so we can see how you do and decide if we're going to engage? I'm like, no, no, I cannot do that. That's free work. And I already have that reputation in the industry where you shouldn't need to have me do that plus referrals. And it was just so, to me, it was so, I don't know, disrespectful. And
Yes, I
I didn't
agree.
like that. Yeah, it was really crazy. I don't know if you've dealt with some of that because 98% of my engagements are so positive. So, we're happy to take them on and they're happy to have us. But boy, that 2% sometimes sure makes a difference.
Well, and I think it's something where, first of all, if you are in business for yourself, or if you're in a position where maybe you work in a company, but you are responsible for business development, or you get, portion percentages based on your own business development, you have to come to terms with the fact that you have to get over not wanting to have any kind of confrontation. And not that everything is an argument, I don't mean that. But what I mean is that even though I could say something in a very, firm straightforward way. It doesn't mean internally I feel that way. Internally, I would love to just run away from the situation. And, it's one of those things where, just like I was saying, we have our standards. You have to know your worth when you're working in this industry. And I've learned that quite a bit. And I know you and I have had a lot of discussions when I come up against some of these conversations with people, because there are going to be people who, first of all, don't even know our industry that well. And I find that when they come in and they ask for help in a certain area, they don't know what they're asking for, and they don't even know the cost of that.
Yeah.
And I had someone recently reach out to me, a man from a tech company, which this is happening quite a bit, where they're approaching in this way. And he had no idea what a consultant would cost in the industry. And I tell you, it was about 1/10, Terry, of what my hourly rate would be. And he was like, well, that's not in our budget. This is what we can pay. And I just responded and I said, well, thank you for reaching out, but
Good luck.
you are looking for someone who would be more so your employee and not an expert consultant. I wish you luck on your project. And then we move along. And you have to do that because, like you said, there's people who will take jobs just to take them. And a lot of times, those particular clients are going to be the ones who are the most needy or have the most difficult situations to navigate. And if you're not getting paid your worth in those situations, it's going to take away your time, which is valuable when you could have been working on other projects.
Yeah.
So, you really have to get a firm grasp of where you are in the industry as you navigate things like your contracts and relationships.
Yeah, I agree. And, you have created this independent service. It's tough when you're in the service industry, which is what consultants really are. We're not in the sales industry. We don't have, if you will, a tangible item that we're selling. We're selling ourselves and our knowledge and, our commitment to what we can do for our clients because of our experience and our background and, what we can do to make you successful. And so, really recognize that. But the consultants that are out there that are listening to this also recognize that if you, and this is a really big one, if you don't know the subject matter, don't take it on. Please don't fake your way through the healthcare industry. There's so many niche carve outs that you can see what is your, not just your passion, but your subject matter expertise. Please don't take something on that you don't know, because what happens is that everything can fall apart. Then you've got some liability, and then we end up getting those clients and have to clean up a mess, and that's not good. So try not to create your own kind of mess, if you will, by take on what you know, what you're comfortable with, what you can do, and it'll make your life a lot easier as well.
Yeah, I agree. And unfortunately, we see a lot of that
You
happening.
do.
And that's one thing as a consultant, when I was saying, that empathy that I have for my clients at times, there are situations where we have to come in and help them through some pretty bad decisions, and they weren't always made with intention on their part. And it is very frustrating when you see that it's based on, another organization. And it doesn't even have to be another consultant. That's not what I'm saying here. But, there's a lot of professional organizations in healthcare. And if they're not run correctly, then it can really do a lot of damage.
It can, for sure. So in closing, basically just telling our listeners, make sure you get out there and network, work with people and that you trust, that have a good reputation in the industry that you can work with, but you're not stealing clients from them and not steamrolling them. Please don't do that. And then also, get to as many consultant conferences that you can, either in person or virtual. I know the NSCHBC Consultants Retreat back in January this month, back last week, was very successful. And also, you're going to hear Stephanie give one of the free webinars for the NSCHBC organization this month. So make sure you check out that at nschbc.org. That'll be the 21st of January. And so, Stephanie, I'd just like to thank you for being on our podcast today. We appreciate your insights into this important topic in the business of medicine, and we hope to have you back again.
Yes, thanks for having me.
You can reach Stephanie at stephanieallardconsulting.com, and you can always find me at nschbc.org under the Find the Consultant tab. Type in my first name, Terry, with a Y, Terry, and poof, there I am. As a reminder, the nschbc.org offers monthly free webinars on a variety of topics, as well as a quarterly Medicare webinar update, which I present. For all educational offerings, go to the nschbc.org and click on Upcoming Education tab. That's it for me today, everyone. Please join me next month when we once again bring you current and important topics in the business side of medicine. Everyone, make it a great day and a great rest of your month, and thank you for listening to the NSCHBC award-winning podcast. My name is Terry Fletcher.
Thank you for listening to the NSCHBC Edge Podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.